Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veera Vidala. Today we're talking about something that genuinely I don't think gets enough attention, at least not in primary care, and that's fertility awareness. As family physicians, we counsel patients on contraception, reproductive health, menstrual irregularities, and sometimes even fertility itself. But fertility awareness methods, the science behind them, how to actually talk to our patients about that, when to refer, that's a conversation that most of us never really get formally trained on. I was at one of these lectures at our recent OAFP conference, and I was blown away. And the person presenting that lecture was Dr. Penick, was here with us. Thank you so much for being here, Dr. Penick.
Yeah.
She's doing extraordinary work for women's health, reproductive science, and at the same time providing family medicine education right here in Oklahoma at St. Anthony's Family Medicine Residency, where she's faculty. She also takes students on from medical school, from OU OU College of Medicine here in the city. And she's an active member of the Fertility Appreciation Collaboration to teach the science or facts. And we're so excited to have her. Dr. Penick, thank you so much for being here.
I'm so happy to be here. We get to hear a lot about one of my favorite things. But if you talk to my residents, we have a patient that has, they'll come in and they may not want birth control. The resident may be kind of stuck on what to do with that. And I'm like, let me tell you about what we can do. Or they have a patient and they go, they're coming in with some infertility concerns and I'm going to refer them to OBGYN. And I go, well, why would you do that when you can do all of this sort of stuff? And they can get stuck in the clinic attending room for 5 minutes as I'm talking to them about all these things that they can do. Yeah, exactly. Yeah. Like, you need to go get your patient care. So.
Well, Dr. Penick, for our listeners, I just want to make sure everyone's aware. Some listeners might be new to this. Can you tell us what really fertility awareness-based methods are and what that entails and how you approach that with the patient?
Absolutely. So if we're defining a fertility awareness method, it's a method of tracking the windows of fertility and infertility in a women's cycle based on objective biomarkers. And so we can get a little bit into that. But there are some things that can be detected and tracked that their presence can be reassuring that things are doing what they're supposed to do. We learn in undergrad and medical school what are the normal things that are supposed to be happening in a reproductive cycle. So FSH and LH, we know that they rise and fall at specific times. We know that estrogen and progesterone rise and fall at specific times. But there are clinical signs of those changes happening. And then with the technology that we have, there's a lot of different ways that we can pick up on those things in order to use that information to make decisions on what a woman's actions are going to be during their cycle. So they may choose to use a fertility awareness method to abstain from intercourse at a given part in their cycle if they're trying to avoid pregnancy in lieu of accepting, traditional birth control for various reasons. And so, we a lot of times think about we can use that to decide when we're going to try to conceive based on the optimal windows, but you can do it conversely as well to avoid pregnancy.
Perfect. So I know there's different components to this, tracking basal body temperature, looking at cervical mucus. The components of this can be used in isolation or in combination. Can you tell us a little bit more about what's generally viewed as the best approach? And I'll use that term in air quotes there, but any of them have value. So, but as you approach this and as you interact with patients, what's kind of the standard for those who use this form of either contraception or trying to gain fertility?
Yeah, so the best method is going to be the one that works best for the person. And so you'll have people that are absolutely uncomfortable checking their cervical mucus, which is understandable. But for some people, that's going to be their best, most reliable method. Some people love the idea of just being able to use a thermometer And, there are ones that you can use orally or axillary, and they have additional digits, and that's the main thing, so that you can detect those minor fluctuations in basal body temperature. But there are also devices that you can wear on your arm, or even the Oura ring, which where people are talking about. And there's some interesting studies on the reliability of those to detect fluctuations. Then with the technology we have, the levels of hormones that we can detect. So looking at like the main hormones that we're talking about and the metabolites, we can use a number of different, oh my gosh, sorry. There are devices that we can use checking urinary hormones once a day, multiple times a day. And the technology, even the last few years, has been so impressive that I am more and more recommending that patients use those in lieu of like blood tests if we're doing diagnostic workup, just for the convenience.
To use the urinary test. Okay.
And, so that they don't have to go to the lab for, daily or every other day estradiol and progesterone trials, because that's a lot on a patient.
Right.
Answer it, remind me if I'm answering your question.
No, yeah, absolutely. That's definitely what I was hoping for.
And then some people there are different methods that we use different combinations of the biomarkers. And so pretty much all of them will track bleeding, because that's, a really obvious sign. They'll look at quantity per day when it's happening in the cycle, cervical mucus. Some methods are more objective in how you are quantifying what you're seeing than others. And that can be helpful for if we're doing medical workup, or for the average person that might be a little bit more than they need if they're having regular cycles. So that can be dependent on what their needs are for that. Symptothermal is one kind of umbrella method that you may use, a combination of cervical mucus and basal body temperature. Because basal body temperature alone isn't necessarily helpful. It's a little bit more retrospective, since progesterone is thermogenic and the temperature rises after the progesterone has risen. You can use it and say, oh, ovulation has occurred, but it's not as prospective in its approach by itself. So there's a number of different methods under those three main umbrellas: cervical mucus, symptothermal, and we would call it symptohormonal, which is using a lot of the urinary hormone tracking.
Okay. So my understanding of this approach, whether it's being used for conception or contraception, is that if used, I don't want to say appropriately, if used diligently, it can be as effective as a contraceptive as many other methods of 1 to 5 women out of 100 getting pregnant. And so those are good statistics. But then I've also seen that for typical use, it may be 75 to 85% effective. So, obviously you mentioned regularity of the cycle. That plays a role if someone can even be a candidate. How do you look at that as a method, and is that something you engage with your patients about? How do you do that?
Absolutely. So regularity of a cycle doesn't rule somebody out for use of a fertility awareness method, but it may make it more difficult for them to be able to utilize as many days for intercourse. And so it really comes down to how willing are they to alter their behavior. It's hard to compare like apples to apples in some ways with fertility awareness methods and contraception. Some of it is when you look at some of the studies that have been done, a lot of the people who are utilizing fertility awareness methods for both pregnancy prevention and achieving pregnancy get lumped together. And so you're
different groups.
Yeah. So if you parse out the people who are just using it to avoid pregnancy, then you get a little bit farther. But then you're also looking at, people who are using traditional contraception, who are not necessarily changing their behavior, but they're, having intercourse randomly, and that, whereas with a fertility awareness method, you are looking at, are they following the instructions to utilize, if they're trying to utilize days of least likely fertility and avoiding on days of higher chance of fertility. And so that you don't have that same degree of behavior change that you're comparing apples to apples, but where you might see the lingo differ a little bit is method versus user effectiveness. If you want to make some sort of parallel to perfect versus typical use, right? Which I think the main thing it really comes down to is the behavior change that you have to look at. If you do look at that, in that level of comparison, you do see that a lot of these, if you look at the methods individually, may have like a 92 to 96%, 97% efficacy rate. Some of the more reliable ones are the symptohormonal. And so it's the traditional calendar rhythm method is definitely the one that you go, well, that's about a 75% effectiveness. And so we've got better technology. We don't want to use that anymore. And so I always tell patients, if you are relying just on your phone, that's predicting your chance of, your chance of being fertile at any given time, you're using the rhythm method. And so you can put your data in, you can learn this, you can have that prospective information to be able to decide, is this a chance that I want to take today? What behavior do I want to choose based on the chance of conception on any given day?
Okay.
And it can be hard for the patient and their spouse, their partner. But that's really what it comes down to. And when I talk about with patients who are interested in a fertility awareness method, but may not have thought about that aspect of it.
Yeah.
Excellent.
Multiple apps out there connecting to Aura too that do it now. Yeah.
Yeah. Natural cycles is one that I've heard a lot about.
I've heard a lot about that one. Well, I think what like struck me during your lecture is the depth of not just, fertility and fertility, but then you were talking about, secondary amenorrhea and hormonal changes. And we, had a conversation off screen about like PMOS now and things like that. I honestly think that's why I thought like, one of the big things about our podcast is to showcase what unique things so many docs out there are doing. And personally, I do outpatient primary care, and I've seen this. It's interesting. It's like almost a rise in infertility in patients who are struggling to have kids. And you talk to like reproductive endocrinologists and like learn from them. It's not something, fertility-based methods aren't something that you see in like a visit there, right? If you go to like OU, reproductive endo and go to the IVF clinic or something. Do you dedicate like visit times to kind of go over this material with patients if this is a method that they like to choose? Like, what does a clinic visit with you look like when we're using the method?
Absolutely. I do get a lot of patients that come to me because this is something that they really want to go into. I mean, again, I see a little bit of everything, all the facets of family medicine, but for those patients that are seeking, help with fertility, miscarriage, I mean, there are a number of things that people will come in for. And some of them will come in having already charted, which is super exciting because we can just dive right in and I can look in the chart and go, this is what I think we are probably going to find with the workup, but let's go ahead and dive in. And I don't have to wait for them to learn a method that we can utilize for diagnostic workup. So if a patient wants to commit to being able to go in depth with the things that I can do, then I do have to talk to them about, okay, I need you to be able to commit to charting these cycles because the things that we might find are, is your body even trying to ovulate? Do you have a normal amount of cervical mucus? How long is your follicular phase and your luteal phase? Because just because of your 30-day cycle doesn't mean you have a healthy luteal phase length. We look at, and then, in-depth history. How long are your cycles? How many days do you bleed? Do you have like abnormal bleeding mid-cycle? Do you have, premenstrual bleeding, which could be a big indicator for premature hormone drop-off, often goes along with PMS. So like all the things that we get into, and there is a ton of overlap. So, when I was talking at the OAFP, often a lot of these will go along with each other. So I'll see a patient that has like maybe abnormally short cycles or maybe they're really, really long. But if they do ovulate, you'll see like luteal phase dysfunction. Their their post-ovulatory phase will be, maybe 5-6 days, when it should be somewhere between 11 and 16. They'll have PMS, they'll have, premenstrual bleeding, all these things that are big indicators of some hormonal aberrancies. And those will very often point back to abnormal ovulation. And then we have to get into, why are we not having normal ovulation? Yeah. And I will tell you, there's so much insulin resistance. Yeah. Even with people who have normal BMIs, I do a lot of fasting insulin and glucose levels and look at, do we have an abnormally high fasting insulin level? And that closes into, is that, that's going to cause downstream effects of abnormal sex hormone binding globulin, abnormal testosterone, estradiol. You're going to have struggles with your ovaries being able to recruit follicles normally. And so, what are those root causes? And my opinion is, if you are going to be treating diabetes, then you need to know how to treat insulin resistance and all the manifestations of it. And of course, that's not all the things that we uncover, but I feel like if I'm going to put people into, broad categories of what I find, one big category is going to be insulin resistance.
Yeah, that's the thing.
Yeah, it's so huge.
Yeah.
Fascinating discussion, and looking forward to hearing more from you on this topic. But listeners and viewers, we've reached the end of this episode. Thank you for joining us, and we'll see you next time on Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.